Guys, it's Edric here with Medical Patient Referrals, and I just wanted to talk about the physical therapy consultation process. So, if you're a physical therapist and you're looking for a new way to grow your clinic besides just relying on physician referrals and MD referrals, the only other way is to do direct access marketing. And one of the best places to get new patients is through Facebook advertising. Reason I say that is because you can generate a new patient for $3 on Facebook, right? So let's just say you put an ad out on Facebook and you talk about your new treatment programs and how you can help people who are in pain, maybe shoulder pain, avoid surgery and get off pain medications. Every $3 that you spend on advertising, you will get someone's name, phone number, and possibly email address signing up from that ad and wanting to speak to you about a physical therapy consultation for their pain and mobility issues, right? So Facebook advertising is a very profitable way for you to grow your physical therapy clinic. Now, that's not with its own drawbacks, because just because you're able to generate interest doesn't mean that any of those opportunities will turn into new patients, unless you have a proven sales process in place. And that's actually what we're going to go over today. So most physical therapists, they go to school for 6 years, 8 years. They learn all about human anatomy. They learn how the body works, where all the muscles are attached, how bones heal, how people get better from pain. And when they decide to open up their clinic or go into private practice, they do not invest anything into business, marketing, sales, operations knowledge. And they expect to be as successful in their business as they are treating patients. But that's just not the case. So I just wanted to give you guys a little sales 101 breakdown of how your evaluations should be going. The first thing that you have to understand when you're doing sales is that telling is not selling. Being a good salesperson means that you are a good listener, you are a good problem finder, and a good problem solver, right? That's what being a good salesperson is: knowing what questions to ask, when to ask them, how to ask them to elicit the right responses in order to push that person to get them to take action so that they can get the help that they need, right? Essentially, sales is basically you just asking questions so that the person will basically sell themselves to you as to why they need your help and your treatment for their condition or whatever their goals are. And just a key cardinal rule that you should follow is, if you're not asking questions and you're not listening to the patient and you're not giving open-ended questions and feedback for whatever they're telling you, then you're losing the sale, right? So let's just say someone walks into the clinic. Let's just say Mary. Hey, Mary, thank you for coming in for your scheduled evaluation. It's nice to meet you. Can you tell me a little bit more about yourself, where you live in this community, how long you've been here before, you know, how do you like this area? Things like that. You want to start off by connecting with the person and learning more about what's going on with the person and learning more about, their life, what they do for work, what they do for fun, and just how long they've been in the neighborhood. So you have a good feel for this person. The second thing that you're going to do is you're going to learn more about their background and find their problems, right? Find out what's going on. So, Mary, tell me why you decided to come in today for this consultation for back pain, right? Tell me what's going on. How long have you had this issue for? They're going to tell you, And then based on whatever their response is, you're going to dive deeper into their question. You're going to get them to open up to you, and you're going to probe deeper and find out why it's important to them, right? So probing questions, how did it start? How is it affecting you? Are there any other issues you're dealing with? How is this making you feel? Things like that. Finding the background of the problem and probing deeper. The second thing that you're going to do is you're going to ask questions regarding the solutions that they've tried in the past. So, Mary, you're telling me you've had this back pain. Tell me the types of treatments that you've tried to try and solve this issue. Right? Have you done surgery? Can you tell me more about that surgery? How did it make you feel? How much money did you spend on it? What happened afterwards? Did you get better? Is surgery something that you want to do again? Right? Have you been to other Have you been to chiropractors? Have you been to other physical therapists? Have you been to acupuncturists? What have they done for you? You want to understand everything that this patient has been through, so you can kind of understand all the treatments that they've tried. So when you present a plan of care, you're not saying something that the person has already tried before, because that's going to turn them off, right? You want to present a new plan of care and a new treatment process for the specific patient, or else they're going to be turned off, and in their head, they're going to be thinking, oh, this doctor is just like any other physical therapist I've been to. This is just a waste of my time, right? That's why it's important to ask all these questions, so you don't repeat yourself and these patients don't think they're wasting their time, right? And you also want to ask them, especially if they're a physical therapy patient, you want to ask them if they're taking pain medications, because we all know that right now that's the current standard of care, and that's what all patients do for their pain. They just take pain medications and they try and slap a band-aid on it and try and deal with this problem. Basically, just live with this pain, right? So that's something that you want to dig into during your evaluations. How long have you been on this pain medication for? Has your doctor told you about the long-term side effects, the long-term complications of this pain medication? Is this something that you want to get off? How is it making you feel? Right? Tell them about all the negative consequences of like pain medications and why they should do their best to avoid it. During the consultation, it's going to be asking questions. It's going to be teaching them and educating them and making sure that they understand the consequences and building rapport, right? So questions to ask during the solutions phase is, you can go into their goals. What would you be able to do if you didn't have this pain anymore? Get them to picture and imagine what their life could be like, right? And then moving on into the consequences questions. If you haven't already asked this is a good time to ask, have you ever thought about what might happen if the problem continues to get worse? Is this something that you want to live with for the rest of your life? Obviously not. Why not? Tell me why this is something that you don't want to live with for the rest of your life, right? Is surgery something that you'd like to avoid? Why is surgery something you'd like to avoid? Why do you want to get off pain medications, right? How would it feel to get off these pain medications? If you were never able to, if you weren't able to walk again in the future, how would that make you feel? Right? Things like that. Get them to imagine what their life would be like if they never got this problem solved for their pain, because that's your job. Your job is not only to help these patients get out of pain, your job is to help them take action, because if you don't get them to take action, guess what? They're just going to keep taking pain medications and thinking that the only way forward is to just deal with this problem and bear with this. But we all know that there's options available to these patients, if they take action. So that's your job as a therapist. You may not have signed up for it. You may not have even realized it, but it is your job. All right. And the last thing that you want to do is you want to qualify them for the plan of care, right? So you want to ask them, you want to get them to sell themselves to you. How important is it for you to find a natural treatment on a scale of 1 to 10? Why is this important to you? What would you be able to do with a natural treatment plan? Being able to avoid surgery and avoid pain medications, right? Why is this something that's important to you now? What would it help you do? If there was a way where we could help you avoid surgery, would that be of any interest to you? If there is a way that we could help you get back to doing the things you love, would that be of interest to you? How do you see a natural plan of care helping you get back to doing the things you love help you, right? Why now? Could it be time for a change, possibly? Could it be time to start strengthening and your body, doing exercises and getting healthier? Is now a good time? Asking these questions basically primes them for when you're presenting your plan of care. So after they've told you that it's very important for them, that now is a great time, that they want to do this because of all these reasons, then you want to transition into presenting your plan of care. Based on what you've told me, Mary, I think you could possibly be a good fit for our new treatment program, right? Because you told me you want to get off surgery. You told me you want to avoid it. You told me you want to get off pain medications. You told me you want to start gardening again. You told me you want to go out and play sports. You want to be healthier. And would it be all right for me to show you this unique treatment protocol that we've created, based on our years of experience helping people just like you? And that's when you'll transition into talking about your credentials and your experience and all of your patient testimonials and your unique process, which we'll go over in another video. So just to recap, physical therapy sales processes to generate new direct access patients starts with these five principles. All right. Telling is not selling. Become a problem finder and a problem solver. Asking questions so that prospects sell themselves to you. And if you're not asking questions, then you're losing the sale. And also you have to be able to ask open-ended questions as well. And basically following this format for your consultations will generate the best results, and the highest chances of getting this patient to take action, so that you can change their life, so that you can help them avoid surgery, you can help them get off pain medications, so that you can grow your clinic and do everything that you've learned in school to help this patient. Because if you don't get this patient to take action, then everything that you've learned in school was a waste of time, because you couldn't get this person to take action. That's why it's so important to be able to learn sales, so that you can get your potential patients to take action with you and get better with you, instead of relying on a standard of care, which is pain medications and opioids right now, which is an easy solution, which will lead them down the path of long-term damage, which we want to avoid as much as possible.